I'm going to go ahead and share the agenda first, and I'll try and pull up his PowerPoint and get started without Dr. Zhao, but hopefully we get him back here soon. Thanks to everyone for being here. Oh,
so sorry. Go ahead, Ava. Keep on going. You will run the show.
No, I was just saying we were waiting for you and your beautiful PowerPoint.
Well, all right. Well, first, I just want to thank everyone for joining today on a beautiful Saturday morning. I know there are a lot of exciting outdoor activities you could do at this moment, or just sleeping a little bit. And it's just so exciting to see all of your faces. I know that we had this pandemic for a long time. Before that, we had plans to have in-person meeting or conference, just bring all the families together. I want to give a little background. When it started, the CRMO clinic, Libby, Beth, and have helped organize the family gatherings and their families from different places far and wide, and we got together for a couple of hours and for the kids to play together. I still have the artwork hanging in my office. Every time I'll bring it in my presentation into the people I give talks about CRMO. Still remember all the faces, and we had a circle and talking about Q&As about CRMO, talking about potential research we should be doing to answer the questions the family have. But I think the most important thing that I have been hearing consistently is how the families can be connected to each other. And to have this one comment from our Kevin, and he said he has been very much looking forward to this event because he had no network surrounding CRMO. To see something like this coming of the research as heartening, to say the least. So sending his love. So I hope he is here as well. Kevin, if you're around, and say hello and wave your hands to everyone. So I think many may feel the same way. And we are hoping next year there will be a chance for us to meet in person. And this is definitely not going to be the last one. And we just appreciate all of you to make time to participate. I hope this will be a very useful session for you. And I want to say, I'm not going to be talking about research updates. So the goal for today is more for everyone, every family, to hear from our entire team and how the clinical care can be provided better and improved, or the resources you may not be fully aware, and also introduce the program. So with that, I'm gonna do the slide sharing. Can everyone see the slide? So I want to give a big shout outs to our planning committee. Melissa, if you want to wave to everyone. Libby, Marie, Beth Gunnarsson, Nora Mahari, Teresa Dawes, Natalie Rosenwasser, and also our tech team, Joey, who is helping us in with the recording, and Ava, who you have all met and received emails from, and our guest speakers. So this is the agenda. We're a little behind, and because I'm not the best host in doing the whole technical stuff, and just to thank you all for tolerating me on that. And we're gonna have Melissa to do a sharing to start off, and we'll have our first round of breakout sessions. So it's a little different. You will stay in the same room as family, and then the leaders will be moved around by us, okay? So the leader will get a gentle reminder about 30 seconds or so, just wrap up. If you're still speaking, finish your sentence, and then you'll be pulled to the next one. So these are the breakout sessions, the mental health and pain management and family support. We recognize that's probably a lot to cram into one. So we'll probably have that session repeat again for the second round. We'll remove the research session. And I'll just do a quick roll call so everyone can. So Dr. Rosenwalser, if you want to say hello, just so people can see your face.
Hi, everyone. Good morning. Thanks for joining us.
And Dr. Tham.
Good morning. I'm super excited to be here with all of you today.
Thank you. Libby Murray.
I'm here. Sorry.
Okay. So Maria Navy is not here. Maria Cervantes. I don't know.
Hi, good morning, everyone.
Oh, great. Thank you for being here. Elisa.
Hi, I'm here. Thanks
Elisa
for
is
being
our
here, guys.
social worker. And then the resource for coping. So Rachel Kinsinger is our child life specialist.
Hey, everybody.
And Teresa Dawes is our nurse. You're muted, Teresa. Okay, well, everyone knows Teresa. So if you don't, so you should ask about Teresa next time when you're in clinic. Cynthia, our other nurse.
Hi, good morning.
And our last breakout room is rehab and physical therapy support. Leslie.
Good morning. And Chelsea's not joining us today.
Thank you for letting me know. And Ava, you already know. So, and then we'll do a little debrief after that. And don't leave after that, okay? We'll have a little break and then we'll come back and there will be a second breakout room kind of session. So I think one great news is that hospital has approved for us to start the CRMO clinical program. We did ask that last year and that because it was a special year. So it is definitely worth waiting and we're just very thankful for the support. And we do have our values aligned with Seattle Children's Hospital with innovation, collaboration, of course, with families and researchers and multiple teams and inclusion. So the goal is really to team up with all of you and the researchers. We can advance the science and also improve the care. And that's the fundamental thing for all of our families. And also the clinical care, everyone knows it's not perfect. So we can do better. And we'll love to hear from you. There have been steadily increased number of cases coming up within our region. So we do see patients from out of region, and these are not included here. As you can see that every year about 30 to 40, and this number may double within a year since the newsletter to all the community physicians within the WEMI will go out next month in describing this condition, describing that we have this program and the streamlined intake form diagnostic algorithm. And the website that Maria Chow, oh, sorry, I forgot Maria Chow. So Maria, can you?
Yes, hi everyone. Good to be here and thank you for joining.
Thank you, Maria. So Maria, I'm sorry. So Maria will be leading one of this breakout room during the second round. So there will be also introduction, but here is related. So her company called Inside Out Medicine has developed this app and many of you have been invited to be enrolled. And also the websites made by the marketing communication will be published pretty soon as well. So the goals are educating the providers and we can shorten the time since when symptoms started our children to the time they see the rheumatologist. Of course, we don't want everybody to be referred to us if they didn't have this, right? So we need to educate them what things they could do while waiting. So that can help us to filter. Maybe they need to see the other providers. So these are the program kind of listing. We have a lot of people and that's the power, it's the teamwork. So many of you have experienced the ups and downs in dealing with this condition. And I think it will be good for us to take a moment and acknowledge that journey. So thanks to Melissa for willing to share her story. So we'll have Melissa give her share her experience here. Go ahead, Melissa. Sorry, Melissa, you're muted.
Can you hear me now? Can you guys hear me okay?
Yes, we can hear you.
Okay, good. I was saying you're completely correct. There are many ups and downs through this. And it was a long journey for us. My son, Brooks, who's 8, he back in April of 2020, right after schools had shut down, started complaining of back pain. And we thought maybe it was just because he was, sitting on the couch doing school versus moving around as much. And it continually got worse and he couldn't stand up straight. It was waking him up out of the middle of the night and he was crying in pain. He couldn't do activities, things like that. And I took him to the doctor and they did an x-ray and they noticed that he had a very slight S-shaped curve. And it was just through the x-ray. They just said, well, it's probably growing pains. It's nothing. And then I called again after it continued and he said, well, here you can do physical therapy. And I just knew in my gut something was not right. And I asked to see someone at Children's. And that was in June when we finally got to see someone. But unfortunately with him, there were many ups and downs where some days he could actually walk and move around and he was okay. And then the next day he could barely walk. And it was very confusing as a parent to know what was going on. And in the summer, he started feeling a little bit better and we thought, okay, maybe it's going away. And then it came back again, pretty bad in September and October, very, very severe. And we saw someone in orthopedics finally, again, and they did an MRI. And once they did the MRI, that's where they found his lesion in his spine. It was his T7. And it took a while because they weren't quite sure what it was. And we needed to do a biopsy. So we waited a few more months and it wasn't, I think, until January that we actually saw you. And it took many, many months just to get into rheumatology and finally figure out what was going on. He had his biopsy in February of last year. And then we have been, or actually, I guess it was February this year, I'm losing track. And he did infusions once a month and was a champ going through that, even though it was really difficult. Continued seeing the clinic and did a couple more MRIs. And as of September, it showed that he was in remission or inactive. And that was like such amazing time to hear that because it's been a really rough journey. Sorry. And he, throughout that whole time of waiting to be diagnosed and finding out that MRI that he had the lesion in his spine, he wasn't able to run, jump, play. He couldn't be a normal 8-year-old boy. And we continued to homeschool him because we couldn't have anyone keep track of him on a playground to play safely. And for most of it, he was in a lot of pain to do much. So hearing that and knowing that I know this is a chronic condition, but hearing that he was in remission and inactive was wonderful. And since then, he started playing soccer again. It's been a long journey for him getting back into sports and running because his muscles throughout this time, we've been doing physical therapy, and I just on my own was taking him swimming to try and keep those muscles going and the core strong. And he played his first soccer season since, gosh, yeah, I know, yay. He played his first soccer season since when things kind of shut down fall 2 years ago. So he had a blast, he had fun. It definitely is still a journey trying to build up those muscles, but he's happy and doing good at the moment. And I am just very, very thankful for the care from all of you guys. We are very lucky to have such a wonderful team here. And my heart goes out to all of you parents. I know we all have a different story, a different journey, and it's a tough one, but I'm thankful that we have each other and such a great team. So thank you for having me here and being able to share my story.
Thank you so much, Marisa, for sharing that. And I really like what you said, that the support for each other. And that's the medical team, we're here for everyone, but I think it's just more important for you all to get connected with each other. And we're super excited to hear that Brooke is back to the soccer. So wish him the best luck for the season. Score more goals. Yeah, score that on the chromo field now, being strong. And yeah. I think this touches a few of the fields during the breakout rooms discussions, and that we're going to talk about the mental health and for our children who are suffering through that, and also to talk about the support through the family circle, and also the physical therapy. And we do have some very exciting kind of pathway we're going to start. Ava, if you're able to assign, so not everyone is going to be assigned into breakout rooms. And again, the families will stay in your breakout rooms 15 minutes. And we may run, by the time we finish, I'll say a little bit over 10. And we're going to do a little debriefing.
Yep, just bear with me for this first one. It's going to be a little much, but hopefully you should all get where you're supposed to be going. So one moment here.
And just spend time with friends and family as well. We also know that it really impacts you as their family members. So as you all know, pain is one of the cornerstones of the diagnosis of chromo. And there can really be different sources that are related to that. So pain can be directly related to the tissue damage that's caused. So that can be from the bony lesions, as you know, the inflammation around those lesions, or pain that is related to the chromo that occurs in other body sites. Another source of pain I also thought Melissa did a really lovely job talking about is just the impact that the diagnosis has on the body and ability to participate in activity as well. So we might see changes and increase in muscle tension, musculoskeletal deconditioning, as well as just changes in the biomechanics of how your body moves and the activities that you can participate in. So those are the type of pain that are kind of most commonly understood and well known. There's also another kind of pain where, which is more often where we get involved in the pain team, that's not as well understood, that really involves, kind of develops over time and involves those pain pathways themselves and how those signals are transmitted through the body, becoming actually sensitized. So this really drives pain through changes in the central nervous system itself, which includes the nerves, the brain, and the spinal cord. So when we think about pain in general and how to best treat it, we know it's really important to focus on those sources and recognize that
Texas, and did adults and peds. So rheumatology is a whole new beast for me, and I'm still learning a lot every day. But it's also been really interesting working with Dr. Zhao. I myself very lucky, and also with, of course, Teresa and all her experience, learning more about CRMO and sharing that with you guys.
This is kind of what we're looking at. There's different types of exercise. There's exercise to improve flexibility. And with each of these types of exercise, there's also grades. So you could do gentle range of motion, or you can do more aggressive, strong stretching. So as therapists, we're determining which of these areas your child needs, but also the intensity that's appropriate for them at the time. So for example, there's flexibility, which is range of motion, just moving the joints and muscles and elongating them. There's static stretching, where you really try to elongate a muscle. There's dance and aquatic activities, which get you moving and maybe easier to tolerate when your child is in pain. There's strengthening activities, and we can start really low with what's called isometric, where you're not really even moving, you're just tightening the muscles and strengthening them that way, all the way to resistive exercise with weight training. And again, those more aggressive forms of exercise may not be appropriate for your child depending on where they are in their disease pattern. We also know that as people have pain and their muscles get weak, they have more difficulty with balance, and balance and coordination is really important to be safe when doing sport and recreational activities. So we often work on balance activities, and there's various ways to do that. And then again, cardiovascular at the level that your child is ready to do, which may be more of a low level. We heard from the parent that they use aquatic activities, which is a really great way to take stress out of an exercise and make it less painful. In many cases, we probably want to avoid what we call plyometrics, or jumping and running, while we're concerned about.
Trainer. He's about to turn 13, and we're working to try to get him more comfortable with handling, and asking questions.
I think when the patient's ready to try it is great. I don't want to push children to do it, but I also know of kids who are going off to college who are 18 and 19 going, I can't do the injection. My mom's always done it. So we try
Right.
We do want the kids to take an active role in what their medicines are and maybe know what they are. Some kids are very amazing. We have some 14, 15, 16, probably 15 to 60-year-olds, the children themselves are calling. So that's, I love that. We do start talking about transition, and that just scares everybody. They don't want to leave us because we're just a happy family. But I think if he's interested, then I think that's a great thing to do.
Okay, thank you. Any tips for getting him to feel more comfortable? He's still a little nervous. He's like, he wants to do it, but he maybe gets a little nervous in the moment.
I think if you, at an appointment, one of the nurses could come up and just talk to him about that. And we could use the fake skin and have him do it.
Okay.
I think that's a good plan.
Okay, thank you.
What age does the pediatrics continue to? Like at what age is the transition where the kids have to, switch to the adult providers?
We like to start thinking about transition early. Children's does see patients to age 21. We like to really think about at age 18 or out of high school, because it's hard for everybody, the whole family and the patient, to transition. But we don't want to wait till that. I'm going to turn 21 tomorrow. You're seeing me, and then I have to go where? So we talk about it early. It's hard with CRMO because there are fewer adult providers who
do not use other kinds of medications, but
can use things like Tylenol to help. Oh. There are some medications that our pain colleagues use also for nerve pain. So medications like gabapentin and pregabalin that can be used. Those medications are not typically prescribed by your rheumatologist, but can be considered if your pain team thinks that they may be helpful for sensitized nerves that may be contributing to the pain that your child's experiencing. All right. And Dr. Tam will go on to our next question, which is, when should my child see the pain team?
So that's an excellent question. Often in discussion with your rheumatologist, when you and your child feel that the pain is persistent, that despite treatment with medications from your rheumatologist, the pain keeps going and doesn't seem to get better. Also, sometimes when the pathophysiology of CRMO does not seem to match the level of pain that your child is experiencing, we are happy to see you. Referring back to Dr. Rosenwasser's discussion on the different types of pain medications for nerve pain, that's also a time at which we would love to see you to help guide some of the medication management. When you see the pain team, we focus on interdisciplinary pain management. So we often collaborate with our rheumatology colleagues, our physical therapists, occupational therapists,
contractures of the joints, but now we're trying to move to more of a proactive program where we see kids initially and try to give children and yourself some ideas on how to maintain flexibility, maintain strength, and continue doing some movement and cardiovascular activities that are appropriate to where you are and where your lesion is. I'm hoping to share my screen because I wanted to give you an idea a little bit about what we look at when we're working with your child. So we know that kids with CRMO have pain. They hold themselves in different postures to relieve that pain. Muscles get tight, muscles get weak. When children aren't participating in at least 60 minutes of physical activity a day, their cardiovascular health decreases. So we look at these various types of exercise related to flexibility.
Sorry,
strength.
Leslie, you're not sharing the screen? Oh, you do. Okay, I'm sorry. Everyone can see the screen, right? It's on my third screen.
Oh, I hope so. So we do activities looking at or improving flexibility, strength, working on balance. When you have pain and you do postural changes, then you have impaired balance, as well as cardiovascular. And with each,
back to what I was just talking about, where pain pathways over time, not in every child, but can become sensitized and heightened. While there's different underlying reasons that this can happen, we in the pain team do see this in children who have an underlying painful condition such as CRMO. And what ultimately happens is that frequent painful stimulus can impact those pain pathways and cause them to function differently and become more sensitized. So when this does occur, sensations that are not typically identified as painful can become translated and interpreted as painful in the nervous system. So they become interpreted as pain. So unlike typical what we're used to, where this is pain that's no longer related to harm to the body or tissue injury, but is such as that inflammation caused by the CRMO, but
introductions. And if anybody has any questions, we also have Rachel from our child life specialist here.
Yeah, I can say hi to everybody. I'm Rachel. I'm with Child Life. We have lots of handouts from Ava that go through some different coping resources. I know the kids, I'll go through a lot of different procedures and a lot of different things throughout the whole journey. So we have lots of different handouts for IVs for infusions, MRI, injections at home, taking medicine, blood draws, all kinds of different things. So I'm happy to either go through some of that, or if people have certain questions, we can talk through different things. Just let me know.
Hi, I'm Teresa, one of the rheumatology nurses. I've been in clinic for 13 years and was on the medical unit prior to that. So I've seen a lot of rheumatology patients in my career here at Children's. We like to help families. What we do, we assist families in learning how to take care of their child at home and empower the families to be able to do that. We're here Monday through Friday. We answer calls. We send back your MyChart messages. If there's something we can't answer, we go straight to Dr. Zhao or Dr. Rosenwasser. Sometimes we ask them to call you because it's very reassuring for families to hear it from the provider rather than the nurse. We do the teaching so that you can take care of your child at home. We just want to make having a diagnosis of CRMO is scary because it is a diagnosis of exception. We've ruled out infection and cancer, and there's still something going on, and so it's a newer diagnosis. And Dr. Zhao, this is his area of interest, and so he spearheaded this whole CRMO program, which is just starting. It's very exciting. Hopefully we'll have more frequent CRMO days, conferences with families. Hopefully they'll be in person. When he was first starting with the CRMO families, we would have a CRMO day here at Children's, and all the families would get to see each other, and it was all very, very exciting. And I'd have to go in and say, shh, you're a little too loud here in clinic now. They would let us use the cafeteria for teaching. It was a marvelous thing. So hopefully in the future, we'll be able to do that again. Do any parents have any questions? A silent group. We were in the last breakout group I was with, we were talking about transitioning and what age we have kids transition. We do this, we start talking about it when children are about 15, 16. Some patients are ready to transition at 18. Most adult providers don't want to see patients until they're 18. We do see kids through college, but we also encourage looking for an adult provider. I tell the teenagers, if you find someone and you're butting heads with that provider, you're not going to go back. So to find someone you can work with. I also explain to the teenagers that the adult world's not warm and fuzzy like it is at Children's. The adults don't give you crackers and juice like we did when you were little. And they may not track you down as we do, saying you're overdue for an appointment. We've got a refill. We haven't seen you in 8 months. You need your MRI. I would like to point out that in the adult world, they'll just get lost to care. And that's frightening for me because I don't want kids to get lost to care. So it's important for the teenagers to start taking some ownership of what's going on for them and preparing them for this big change.
I saw a question in the chat asking if we have adult providers who specialize in CRMO. I don't think we have a list. That's a great question. And so that's something we can work on with Dr. Zhao. I know there is, I think, 1 or 2 other people adult providers that he knows about. So that's a great question. And that's a resource we can definitely get together.
Cynthia, I can answer that. So locally, Dr. Jenna Thompson, she's an adult rheumatologist at Harborview. So I've been transitioning the last 4 or 5 patients to see her, at least within a 2 hours radius, and people are willing. Number one, she is interested in taking care of young adults. So she has a transition clinic and she has a crew, so they know the challenges, for the young adults. And number two, she's very willing to work together, and she has a great communication. After she sees a patient, she'll say, hey, what do you think MRI? And she's working with the MRI radiologist over there to set up whole body MRI over there as well. So hopefully that will be in place very soon. Another physician called Philip Nice, he's based at Swedish. And he had a special interest because he is the world expert on ankylosing spondylitis and psoriatic arthritis. The two have a lot of overlapping with CRMO. And he already had the whole body MRI figured it out. But he's kind of in a private practice environment. And he also is very into research. So he have all the choir registry forms that I have shared with him, so he can collect those data continuously, so we can stitch the data out in the future. And the care, I think either place. What we need to do is, in day 2 will be the beacons, and then they can start spreading the words into the rest of the team in the adult rheumatology world. Is it time to switch yet? I thought we still have 4 minutes.
We've been switched.
Oh, you are? Okay.
We're here.
Then we'll switch then. So you guys can take the floor.
All right. So my name's Paula. I'm one of the pain physicians at Children's with Dr. Tam. And we have a chance to frequently work with Dr. Rosenwasser, and that involves all the people in your team, and focusing really on the tissue damage as well that can be caused by things like CRMO, as well as focusing on different things that play a role in pain, such as mental health, stress, physical activity, and sleep. So one of the first questions we hear is, why does my child have pain if my rheumatologist thinks the inflammation has been well controlled? So this goes back to that kind of third source of pain, where we know over time pain pathways can become sensitized and heightened. There's different reasons that this can occur. It doesn't always occur, but can. And we know that one of those reasons that it can occur is, or we see it occur in children who have an underlying painful condition, and that frequent stimulus of pain over time can change how those nervous system pathways and pain pathways function, leading to that sensitization. So when this occurs, the sensations that are not usually painful become translated and interpreted in the nervous system as pain. So pain is no longer then related to that harm or tissue damage, such as the inflammation in CRMO, but rather reflects those changes in the nervous system. So you can have improvements in inflammation and the actual CRMO is really well controlled, but that pain persists, so it's out of proportion to expectations of that pathophysiology of the CRMO. So another question we often hear is, what should my child do if activity causes more pain? So activity can cause pain for different reasons. It may be that our nervous system is trying to protect the body from future pain. Also, we all know that with deconditioning and trying to use
is under control. To include jumping activities and getting them back to their regular sport activities. I will stop sharing and explain a little bit about the new program. We're hoping that new patients are seen by either Chelsea or myself. As we get going, we will probably try to get some therapists in our outreach clinics involved. And then we can make recommendations to local clinics in your area, as well as sport clinics, either in your area or on one of our sites. I had a parent in another breakout room talk about how important it was for them to come to our pool. Unfortunately, Seattle Children's closed the pool at the beginning of the pandemic, and we don't plan to reopen that. But as physical therapists, we're always searching for other places that we can refer patients. And we do have some leads on where there could be warm water pools or warm water there are therapists who are working in warm water pools. So I wanted to give some time to open it up to see what experiences you've had with physical therapy. If you have any questions about physical therapy and what our program may look like in the future. Any questions? Feel free to, you can unmute yourself.
I have a question.
Uh-huh.
So through this whole process with my son, and still now we're doing physical therapy, and trying to get him to do some of those at this point now is a battle. Because we've tried to make it fun and like a game and things like this, but it just, it's a challenge. So do you have any suggestions on motivation or anything to get him more interested in doing those exercises every day?
Well, depending on what kind of exercises there might be some ways to make them a little fun. I think you said your child was more around 8. Is that right?
Yeah, he's 8. So you really need a little more play oriented, which we've been trying to do, but he's smart and understands that this is exercises that he could be doing something else, and doesn't, he realizes it's his physical therapy, and so he fights it.
So some of those exercises might be able to be transitioned onto like a therapy ball or a yoga ball. So working with your therapist and they're usually not too expensive. At the beginning of the year, they go on sale around January when all the other exercise equipment goes on sale, but that might changing it up. So we often can have one exercise that we can put on the ball and it seems like something different. Or having different exercises to do, these exercises one week, these exercises another, because the repetitiveness of the same exercise.
Hello, everyone. So good to see all of you. Josephine, hope the weather in Alaska is good.
It's -20 out this morning.
No kidding. Wow. Well, to stay warm. I don't know if there are other questions coming up, or Libby have collected anything from the Facebook group at all.
I haven't asked. We tried to keep it a little bit low key on the Pacific Northwest group, just since when word gets out that we're doing something at Seattle Children's Hospital, it kind of blows. Everybody else is like, why can't we come? We want to come. So we tried to keep it really low key this time. So.
Well, thank you for posting all these and being thoughtful about it. We can see in the future, but it just, I think gradually once we have the set formats, maybe some of the broadcast in the future for educational, people can just watch it, and that will be totally fine.
I think it's really important for us to just be able to connect locally. I mean, just within the Pacific Northwest, there's a lot of us that actually do connect or talk specifically with each other. And I think it's really important for us to have those specific connections. So I'm grateful for them. Grateful for this opportunity. Thanks, Dan.
Is there a Facebook group for parents?
There is. We're going to talk about that in just a minute. I think when we get started, I think we've got another minute, don't we, Dan, before we get started?
I guess.
Should we just get started?
Yeah, why not?
Okay. All right. Do you want me to just go ahead? I'll just go ahead and start. How about? For those who don't know me, I'm Libby Murray. I am a self-proclaimed volunteer patient advocate. That's my made up title. I made it up myself. I was really emotional as we started the meeting. I started to get really teary-eyed because it was 14 years ago that my daughter was diagnosed, and we were told that we would never find another CRMO patient and never see any researchers. And as I'm looking at 40, what are we at? We were at 48, I think, participants in this meeting, in this conference. I just started to get emotional because this is what it's all about. It's about actually supporting each other, coming together. Having patients meet patients is powerful. It's so great for their mental health and for their understanding and well-being. I mean, it also really helps for patients or for parents or caregivers to be able to have that support as well. There's a couple breakout sessions that I was in that a parent would say something and I would go, oh, I wish I could answer that question, because we have personal experiences that when we share with each other, it's really powerful. There is, so again, I'm just a parent of a CRMO child who's almost a CRMO adult now. She transitions, she'll be 18 in 2 months. So she had onset when she was 4. So we've been on this road for a long time. But when we were told that we really wouldn't find anybody else, I kind of made it a personal mission to find people and to make connections. And so I started a Facebook group many years ago. And I know that Facebook isn't super popular with everybody. Social media is kind of questionable whether you want to participate or not. But currently we have over 4,300 patients or caregivers who are part of the international Facebook CRMO awareness group. It's a powerful place if you have a question, or if you want to share that you're exasperated, or if you want to be able to say, hey, who's in my area? We have the large main group. It's an international group, again, 4,300. And then we have a smaller group. We've tried to give localized groups as well. So we have one, and maybe you know about it, maybe you don't, but it's called the CRMO Pacific Northwest. And it's just for us who are at this conference today. It gives us the opportunity to say, hey, we're going out to dinner tonight. Does anybody want to come? Or, hey, we're going to have a conference. Let's really get on this. Or oftentimes we'll have research opportunities that we can participate in, and we'll connect that way. So for example, just this last week, I was speaking with a physician who wanted to study CRMO adults. He's out of Iowa. And I was able to go onto the CRMO Facebook group and say, if you are a CRMO adult, come participate with us. And all of a sudden, all of those adults just came really quickly to that aid of that researcher to move research forward. We have a really powerful platform here, I think. And I'm really grateful to be able to, I know so many people, and I'm so grateful for the connections that I've made on this site. And also just through conferences and things, I've made lifetime friends through a few of the CRMO conferences that we've had. So I'm just going to encourage you. We have a few other things. So again, the Facebook group is a great way to connect either internationally or locally. We also have a small charity. It's a nonprofit organization run by a young woman who started it as a Girl Scout called Kayla's Comfort. And they send out care packages to anybody who has CRMO, and oftentimes their parents or their caregivers or a sibling. So if you feel like you need support, that's also another really great place to go, is Kayla's Comfort. And I won't talk too long. I know we've got a lot of other supports out there. I'm going to let Maria take some time, and then she can pass it off to Eliza. So.
Awesome. Thank you so much, Libby. And you basically hit the nail on the head on so many points. So for those of you that might not know me, my name is Maria. I work out of Main Campus. My official title is Family Support Specialist. And so what that means, or kind of my niche within the hospital, is really helping parents or caregivers connect to one another. It's typically specific to parents. I will say that the peer-to-peer for the youth or for the patients is so, so important. And I have also done some of those matches. And I'll tell you how to get connected to that if you're interested. The caveat that I give there is that when those matches are done, it's the parent or the caregiver to the caregiver, and then they consent for their minor. Because just with age of consent, we need to do it that way. But yeah, so essentially I help connect parents one-on-one typically, because oftentimes there might be not just whole established support groups. In this case, it's so nice that there is a Facebook group, but some conditions don't. So I do go ahead, do those one-on-one matches to parents. And I also oversee like our support groups in general. So we have over 20 groups here at hospital from a variety of diagnostic backgrounds. And I'll go ahead and put that in the chat as well, how to get connected to me and to any of our, oops, no, it's not. Okay, I'll go ahead and put that in a minute once I'm done talking. But how to get connected to those resources. The other thing that I wanted to mention, and Libby, you also touched on it, is siblings. So oftentimes siblings, they're processing and going through it as well. And so Child Life has something called Sib Shops. Right now they have migrated to an online platform, and it's actually free right now. So I'll also include that link in there. And I think that it's also integrated within our support groups. If you want to check that out, because that's often been a really wonderful resource for siblings. And there's like age groups, and it's also kind of department or service specific. So I believe that there's a day for siblings of patients that are touched by like rheumatological conditions. So that's a little bit about me and the work I do here in a nutshell. I'll pass it on to Eliza, and then I will, while she's talking, I'll also be putting in some links into the chat. And also let me know if you have any questions. I'm happy to take questions.
All right. Well, thank you. Good morning, everyone. My name is Eliza Yoon. I am the social worker assigned to this CRMO Inside Out project. So Libby hit like a lot of the things that I was going to say about like Kayla's comfort and things like that. I am new to CRMO, so I don't know too much about it, but I did find that there are Facebook groups. There's Kayla's Comfort that will give out packages, and it sounds like Maria kind of hit the nail on the spot, like of facilitating like groups for parents, because this, I just want to acknowledge that this is a very, very hard disease, because it's a process of elimination. There's a lot of unknowns, and like the first parent spoke about how it took about a year. That's ridiculous. That's a lot of anxiety, and I just want to acknowledge that that exists. And one thing I was going to put in on Inside Out with Maria, Maria Cho, is Washington Mental Health Referral Service line. It's also on our like website and Seattle Children's. It's just a phone number you can call. It's statewide. They kind of do the legwork for you. They look at your insurance, they look at what your child needs and do an intake, and they give you like 3 to 5 lists of like people that already accept your insurance, and most of the time who are accepting new patients. So you don't have to keep calling around the services around your area. I will say that there's a huge shortage of providers right now for mental health, and that a lot of people are doing telehealth just because of the pandemic. But so there are other apps too, like that you can talk to a licensed therapist, but I personally as a social worker would prefer that every patient who wants to get into counseling and things like that would have that rapport building of being in person at first. And then there's also some hotlines for youth that I'm gonna ask Maria to put up and Inside Out too. It's like a crisis text line for teenagers and things like that, because I know CRMO affects a lot of like pre-adolescents and adolescents. And I will share this fact that rheumatology, my coworker Beth, she's a social worker for that area. She's had so many, we have an initiative nationwide for zero suicides, and a lot of zero suicides for our team comes from rheumatology. So chronic pain and things like that, like maybe children don't want to talk about it, but suicidality is something that is very serious and it's very here. So these are the 2 things that I give for most of my patients that are screened for zero suicide. So, I'm here for a resource. And since I am new to this, if you have any other resources, like I didn't know that there's a Pacific Northwest Facebook group, that's great. Like, let me know. And if there's any resources that you want to see, please let me know. I'm very open to feedback because I am so new to this. And we can just kind of get the ball rolling there. We just really want to be a support for this because this is a really hard this disease to live with.
Thank you. I wanted to add something to that. Libby, you also, it touches at my heartstrings when I hear you say, 14 years ago, you were told that you would never meet anybody else. And, events like this, that's the power of it, is when we come together and really having those organic connections can be so powerful. So if you have any questions for us, oh, are we switching? Oh,
I think they are. Yeah. So I'll continue that kind of sentence and topic. I think the power is the mentoring, and I'm mentoring 20 undergrad students, and what the way I set up is, for the established students, for them to, mentor the upcoming class. I found that it's super empowering for all of them. Because that's a growing process, right? And we all do that in life and for different things as well. And we have very dedicated, families here, as you can see, Libby, and I know quite a few others as well. They're willing to share with the other families and what they have gone through, and hold their hands, through those processes, as you all, or at least some, may have experienced, dealing with insurance and dealing with the school, accommodation and all that, and it's not the easy kind of process. So we could potentially, when we talk to Maria Chow, we could have one checkbox. Are you interested in being connected? And then we can do a little kind of matching thing too, and that will be through the other Maria. So, Maria, we're just talking about how our patient support system, because now is every time they ask me, hey, who do you think? But I think we can embed it in your application as well. There's a checkbox if people are interested in.
Yeah, fantastic.
Go ahead.
All right. So hi, everybody. My name is Maria Cho, and I'm founder of Inside Out Care. That is your CRMO Care app that the team will be using to communicate with you on what's coming up, what's due, information you might like to have before your appointment or when you're starting your next treatment, and when things are due for you, meaning, oh, in 6 months, time to get another MRI, or when to come back. And these are the different providers to see for physical therapy, for pain, et cetera. The reason we want to do this is to make sure you have a single location for all of your CRMO care, and so that you can see what's coming up. I want to make sure you understand it's distinct from your medical record, meaning you're not getting your results of testing or the actual results of the MRI. This is about what you need to do, what you need to know, and when you need to know it, so that you can be prepared instead of taken off guard. And things like you can see transition coming up, you can start looking at what to do and when. A couple of principles. One, it's always free. There's no cost ever to using this. You can use it on any device, meaning a phone, a tablet, a computer. And then it's available in multiple languages, and you can share it with your family members, meaning if your child is over 13, your child can see it, you can see it. The whole point is to see what's coming up and when. So those are the key principles behind it. What I'd like to do is make this a discussion session, because this is for you and about you. So what I'd like to say is go ahead and take your computers off mute and please chime in. What we want to hear today is feedback on what you would like to see, what would have been helpful in information when you were waiting to see radiology, in between appointments, when you're going to start another treatment. I'd like to hear, what would you like in terms of reminders, what tips or information would you have liked, what would be helpful to you when interacting, when looking at your CRMO care plan, whether that's for diagnosis or treatment. We'd love to hear your feedback. And then while people are talking, please feel free to type in the chat box too. We want to get as much feedback as possible. So please share thoughts.
Has anybody signed up yet? The app? No? Okay. Did you receive the invitation? Okay, Laura, you did. Would you like to speak up? You're muted.
Yes, I received the invitation, I think yesterday or day before, and I signed up, and I was glad to hear the differentiation between my chart and this app. So, because I use my chart a lot to communicate with you and also with Dr. Belay, and just I appreciate the quick responses from you guys whenever I ask a question on my chart. So,
and we should continue to use my chart for that function.
Right. Okay.
Right. So there is a little echo. I'm gonna mute you first.
Oh.
Okay. So the difference between the inside out medicine and that, and one is I think it targets the new patients. It helps them prepare, for the first one. So we have these checklists. Often that happens. They come to see us, and the information is not available. So we can't. They have to more phone calls after the first visit, or wait until the second visit. So we want to prepare them as much as possible, and families can participate in that process, right? You can get the medical records, and often I'm a patient myself as well, and I have been calling in trying to get my information. It's just difficult, right? How they can, if you have a copy in your hands, things are a lot easier. We can make copies, and even it could be some extra work. It'll be worth doing. And also explaining the whole body MRI and the bone biopsy if it were needed and all that. These are more kind of prep work instead of waits until the day of visit and during the headlight that they could start reading, right? So that's very important. Now for the established patients, what has happened before is that they come in, family will come in, oh, I didn't know we need MRI, right? And then we have to schedule that after the visits and have another phone call. So how we can streamline the process and capture all these kind of misses, and then we can have a better communication. Now that if you need to schedule, you still have to go through the My Chart. So don't use the inside out medicine and say, hey, I need to schedule this and can your team help? It's probably not going to be a kind of communication. But I'll let Maria and Ava talk about that. How is that? How does it fit in during the care?
So thank you. What we'll say is we've purposely designed to make sure that there's no overlap. So you won't be confused on, am I supposed to use inside out care for this, or am I supposed to use My Chart? What you'll be getting is reminders. So you will get an email or a text that says reminder, activity due, and it will tell you you'll need to schedule a whole body MRI, or you have an upcoming appointment with CRMO Clinic. Here are 3 tips, right? So it could say, make sure before an appointment, if you're not sure that you need a whole body MRI, and you actually will have them assigned for you saying, go ahead and schedule one. So it will tell you, schedule this. It will tell you, expect, a half a day for an appointment, or it will send you an email that says, make sure you filled out these forms or completed these things. So you'll get reminders when tasks are due. If you have physical therapy that you're supposed to initiate, or even start planning for transition before your next appointment, those are the kinds of things that Inside Out Care will prompt you with. It will also have for if you're starting a different kind of treatment. Here's information about side effects. Here's information on how to prepare your child. Here's pain management techniques for this specific treatment. So it's all of the education and things that you get, which can feel a little overwhelming if you were to get it all at once in the actual appointment, right? You'll be learning about, hey, we're going to be discussing these things, read this, and you can follow up on it after you leave, right? And you have an electronic version of it, so you can see it anytime.
And I just saw some comments in the chat box from Marcy and Maria. They say it's an incredible service. So thanks, Maria.
Well, this is for all of you, right? It's for all of us parents so that we can see and be prepared. It's really hard to absorb information in a 30-minute session with our providers. Really hard to share it, and then hard for our children too. So the more we can do this and prepare and give information and coordinate along with supporting reminders, then we can combine appointments, we can prep for it, and you can plan, right, with your child what to do. And then you know what you're looking for. And then you have your questions identified early too. That's super important, because it's nothing worse than going home and I forgot to ask that, or I didn't think about this. And then you got to drag out everything again.
Yeah.
And even though it's a super responsive team, it's great to be able to have that information
So
ahead of
Maria,
time.
Josephine has a question.
Yes, please.
I was just gonna say, I'll have to go back and see if we actually got an invite, because I was not aware of this program. So if I see something I'm not sure of, I assume it's spam. If I need a new invite to sign up for the program, how do I do that?
I can double check that. I'll go through it every once in a while and make sure, and double check that.
Yeah,
you
I
have
was
a
unaware,
valid,
so I wasn't sure. I'll go back and look. I can't do it while I'm on my phone with this, but I will double check.
It should be from a CRMO program at seattleChildren's.org. So go to your, right, Ava?
I think it would be from Seattle Children's via Inside Out Care.
Oh, I see. Okay.
Look for an email from Inside Out Care. You will get a reminder. If you don't, then feel free to contact Ava, and she will make sure.
Yeah.
You will be getting a link, whether you did or did not yet get one. It's possible that a few people haven't gotten theirs. Everyone will be getting one before your appointment. You will definitely be enrolled. And the whole point is to have the service open at all times. So you'll be able to see everything you've ever had. You can see what's complete and what's coming up. So that you'll always be able to track your care.
So Josephine, you can email CRMO program at seattlechildrens.org. So that way you can let Ava know. Thank you. Are there any other questions from the group?
Yeah,
comments?
Yeah, just wanted to ask quickly is, with many Chroma kids, they have a lot of different specialists. Does this tie in GI, dermatology, infectious disease, or is it more focused on the rheumatology aspect?
It starts with the rheumatology aspect. It will, if you have all of these other providers. For some of the services, they're also using it in detail, but at least if it starts from rheumatology and they say, go see GI or go see dermatology and follow up with them, you will have that as well. So you know how you get expanded into the world of many, many providers. Well, Chroma will be your base for the rheumatology aspect to start that off. Some of the other teams are using it and they'll continue adding to it. So anything you get on Inside Out Care will always be in that single location. You will not be getting multiple different apps, but the point is Chroma will be coordinating all of the.
Yeah, so to finish the sentence, Keith, I think maybe you're asking this, IBD service has the app, and this, skin in dermatology, they didn't have the bandwidth, so it's a dedicated effort. We had the hospital support. One is the financially and also protected time to design it. I can tell you, TD, Cynthia, and Dr. Rosenwasser and I, Maria, we spent the last, since probably August, 3 months, and there are a lot of material, and we have to work with a patient educator. So it's a long process. But I would think one is we work closely with all these teams, and once it's up and running, and you can bring it up to a provider. And I'm going to share, we have monthly multidisciplinary case review. So I can take 5 minutes just to showcase, how wonderful this is. And then from their perspective, they can ask the hospital, hey, we want to do this as well. And then they need to develop the content. And that can be all under your own accounts. And here is the CRMO, here is the IBD, and how they can correlate. Because the challenge for you will be, how do my appointments all staggered and lined up, right? Can it be done more seamlessly? I don't think we're there yet, but that will be the goal in the future.
Thank you.
You're welcome. All right, I'll let our next team take the floor here.
Hi guys, I don't know, Michelle has dropped off somewhere along the way, but the session is to talk about prior authorizations. So we have Michelle Medley, who is our patient support coordinator, and her whole job is to work on prior authorizations. The main bulk of her work is through injectable medications. So that would be like your Humira, Symphony, things like that. We have an insurance processing department at the hospital who works on prior authorizations for infusions and imaging. So they do the initial work on that, but Michelle also helps the providers with appeal letters and things. So just kind of some background. I'm sure you guys know by now that there aren't any medications that are FDA approved for CRMO, for CRMO. And so when Dr. Zhao or Dr. Rosenwasser prescribes you something like Humira, the first thing that we do, or that Michelle does, is submit all of your clinical information to your insurance. So that includes chart notes and labs and imaging reports. And it can take 7 to 10 business days or so to hear back from your insurance. In all likelihood, for your CRMO kiddos, it's going to be denied. And then Dr. Zhao and Michelle have worked together to make some template letters for what's called a letter of medical necessity, explaining why your child does indeed need the medication that was prescribed. And so they get that submitted. They just plug in your child's information and get that submitted to your insurance as quickly as possible. That portion can take, that appeal can take up to 30 business days to hear back from, once again. And then there is a chance that that appeal will still be denied. And usually at that point, they will do what's called a peer-to-peer, where Dr. Zhao or Dr. Rosenwasser will speak directly with another doctor at your insurance company and try to explain once again why this medication is needed. And so as you can imagine, it can take up to a few months to actually get an answer from your insurance company, which can be really frustrating. I think Michelle, her recommendation is that if you are having a really difficult appeal, to contact your insurance company and ask for a case manager, and they can kind of be a liaison between us and your insurance on your behalf, and kind of takes you out from being the middleman a little bit. Michelle, especially if we're going through a denial on things, she'll contact you and usually give you her direct contact line, because she is the one contacting your insurance and doing all of that hard work. And so she'll give you that information. And she recommends, if you have a question about the PA status or what's going on, to call her directly, so she can answer your question, or she can contact your insurance on your behalf. I know you guys are so eager to get your kids medication, and sometimes when you call your own insurance, you're just speaking to a customer service agent, and so sometimes they give you information that's not correct. And then you call us back and tell us what they said, and it's different from what we were told. So Michelle says that if you have a question about status or what's going on, to just give us a call, so we can fill you in, or she can contact your insurance on her behalf, or on your behalf, to get some more accurate information on what's actually happening and where everything is at in the process. There were some questions in the last group about imaging. So those MRIs get denied a lot, which can be frustrating. Our insurance processing department is the one that actually works on all imaging for the hospital. And so they will contact Dr. Zhao or Dr. Rosenwasser if your child's imaging has been denied. And Michelle does help with some of those appeals, but it's really our insurance processing department who is in contact with your insurance. So they typically, I believe, call you if things have been denied. But if you have any questions, you can call us, the nurses, and we can give you their contact information, and they can let you know where that process is. And that's the same thing that's true of infusion medications. Teresa, do you have anything to add?
I know that sometimes we get calls from families to let us know they have a denial letter. I think it takes longer for the denial letter to get to families than the facts we've received. So a lot of times Michelle's already taken it to the next step, and the medication is already under appeal. Some insurance companies are just more difficult than others. We recommend, if there's a giant lag between when the prescription was written and if you ever get it, to either contact the state insurance commissioner, because that person does investigate these. We had one family who just went on social media and commented about their insurance company, and then things turned around quickly for them. I think if you use social media correctly, that can be very helpful. So I do throw that out at families, because I want our kids to get their medicines so that they can get better and get back to their usual self, because they're miserable, they don't feel good, and we don't want to just partially treat. We know what medications work, and we want to get that going as soon as possible. The last group asked about if Michelle helped with referrals for physical therapy, and I think that comes up very infrequently. Hopefully the insurance company would reach out to us and we would, send a letter or some reason why the child needs to have physical therapy. So if you have issues, just give us a call and we'll see what we can do to help you.
We don't have a template on that yet, but with our new kind of PT program, we'll have the data, and I'm sure we'll have the publication on that, and we can strengthen the case. But sometimes they have the stipulation in the insurance and say, even there is evidence, these are the limits that they will pay for it, just the planet, what the planet is, and that we cannot appeal, right? That's what we sign up. And the other thing I want to add is the consent. So a lot of times the insurance require us to obtain the permission from you all. So that could be part of the things we add to the inside out medicine if that happens. And there are different letters. It's not a universal one just to say a consent, then we can put in there. But that could be a place can upload, or my chart. I think the my chart will be probably a better place. You can snap. I believe that you can just snap a picture with your phone upload, because plenty of parents have the ability to upload the photos.
A lot of times if there's a consent that needs to be signed, Michelle will send it to the nurses, and then we download we print the form and send it to the families with a prepaid envelope inside. So when they return it, they're not paying postage. But that does also delays care. If there's a way we can get it to you guys faster, then that's perfect. If we can email it, you can download it, sign it, email it back to us, that would be grand. But some people don't have access to that. So we do what we can to get this going as fast as possible.
Yeah.
There was a question in the chat about if you're going to change insurance. Let us know right away when you're going to change insurance. We need your new insurance company, your ID number, your group number, all of that information, and let us know the date it's going to be affected, or I'm sorry, the date that it's going to be effective. And that way we can submit that new authorization as soon as possible. I know a lot of people switch insurances on January 1st, so call us as soon as you're able, but we're not able to start that new PA until the day that your insurance starts. So even if you call us December 20th, we can't submit until January 1st, unfortunately.
And what happens for some families is